National Lung Cancer Awareness Month. Every year, over 200,000 Americans are diagnosed with the disease, making it one of the most common types of cancers in the U.S. And joining us now is Dr. Gertz Klecker with the Brown Cancer Center. Doctor, thank you for being here.
Thanks for inviting me.
Right now, we hear much of the time, I'm hearing people talking a little bit about people who are getting lung cancer who were not smokers. I guess it's about 10 to 20%.
Exactly
is that
right.
correct?
Yes, yes.
Why, are we hearing more about it, or is it just that those cases are so rare people talk about it?
Yeah, we hear more, and
Okay.
there are more cases, and 10 to 20% of patients with lung cancer never smoked. Never smoking means less than 100 cigarettes during a lifetime. And why would they have lung cancer? There's passive smoking. Then there's radon, radioactive gas that comes out of the ground. Unfortunately, in Kentucky, you can find that in houses, so you should check for it. Air pollution is more and more a problem. Sometimes it's the work environment, welding is a risk factor. So other reasons besides smoking.
All right. Genetic factors also?
In lung cancer, that's relatively rare.
Okay.
It runs in families, but it doesn't mean because the genes run in families, because the habit of smoking runs in families.
Okay. What are the signs and symptoms of lung cancer?
It would be nice if it would be that easy. The problem with lung cancer is the symptoms are what you have with a common cold or chronic bronchitis, so it's cough, shortness of breath, maybe you even cough up a little bit of blood, but none of this is specific for lung cancer. And many patients may not have any symptoms for a long period of time.
Okay. Is there a certain age that we would see?
The risk increases after 50, especially in smokers, and then it increases every decade more.
Okay. And talk about some of the screening guidelines
Yeah.
for lung cancer.
That's very important. So in patients or persons who smoked a cigarette a day for at least 20 years, and they're older, between 50 and 80, we would advise lung cancer screening, which is a CAT scan with very little radiation, just like a mammogram. And you need to do this yearly. And if you do this, you cut your risk of dying from lung cancer by 20%.
Wow.
Yeah.
All right. And that's one of the resources. Other resources are available for folks too.
Oh, yeah. Besides CT, there are many other things. But the first thing is, when you're in that risk group, 50 to 80, and you smoked half of your life, talk to your doctor and get it checked out.
All right. Doctor, thank you so much for joining us. We certainly appreciate your time today.
Thank you
A very
very much.
important issue for sure.